Initially, probably one of the earliest materials is dental amalgam, which is that mixture of metals. It goes in the hole, it sets in the hole. It had a property that it expanded a little bit, so it did a really, really good job of fixing holes, which was its objective. It also happened to contain mercury. It also happens to look black, but people accepted that as a price to pay to keep the tooth. When people started to get more cosmetically driven, we started to say we expect the material both to fill the hole and look good. And so we started to look for alternate materials, in which case we've developed nowadays a material called composite resin. It's a plastic filling material, and plastic we can make white, but unlike the amalgams, the plastic is a liquid when it goes in, so it's a putty. And as it sets, it shrinks, and all plastics undergo a thing called polymerization shrinkage. So the problem with this material is that when we put it in a hole as a liquid, and then when it goes to a solid, it became a little bit smaller, and it always left a little gap. And over time, that gap was the thing that allowed more bacteria to get in. So what happened was the material was designed to look better, not to fill the hole better. Its perspective was a very different thing. So we got a material that worked cosmetically better, but clinically not as good. On top of that, the material, to get it to work even similar to amalgam, became more technique sensitive. So amalgam as a material, you could stick it in a wet mouth, patient could be trying to swallow on you, and this thing would just do its thing. It would set underwater. So those are probably your two cheap filling materials, amalgam and composite resin. If you're a person that really wants the best and you start asking your dentist questions like, what is the best material? What would you put in on your daughter, your mother, your brother, your sister? Then we will start to talk about materials that most people didn't even really know existed. Things like porcelain and gold, which, yes, you can make porcelain fillings, yes, you can make gold fillings. These filling materials are much, much more expensive, but they're dimensionally stable. The reason why they're stable, we make them outside the mouth and glue them in. Because they don't change shape, they're not expanding, they're not shrinking, the filling should stay the same shape, and now it's just up to the patient again to keep things clean.